Well, carpal tunnel syndrome is a very common disorder affecting nearly 3 million Americans every year. The good news is that it's very treatable and in fact is preventable and in many cases reversible. Dr. Ford is here to break it on down for us. And we got to start with maybe you can explain to us just what exactly carpal tunnel is.
Carpal tunnel syndrome is a peripheral nerve entrapment syndrome, and it involves the median nerve, which goes across the wrist and gives innervation to usually these three fingers.
Okay.
Symptoms, most patients will notice a numbness or tingling in their hand. They'll develop some clumsiness with fine work. It awakens people at night. They shake their hands to wake them back up. Those are all very common symptoms of carpal tunnel syndrome.
So the most common symptoms is feeling that numbness, usually in your ring finger and your pinky finger.
No, that's a different nerve. That's the nerve that you hit when you hit your funny bone. That's your ulnar nerve. Carpal tunnel is these three fingers.
Okay.
So, and it affects, it's very, very common. It's most of the people we see, we don't know what causes it. It's very common in pregnancy because of fluid retention, and it causes increased pressure in the carpal tunnel itself and presses on the nerve, and that can usually be treated with steroid injection or splinting at night particular, and usually after the patient delivers, the carpal tunnel syndrome goes away, and at least 90% of the time it goes away.
For other people, if pregnancy is not included, how often are they feeling that numbness in their fingers before they need to realize they need to go and talk to somebody?
Well, usually if you do a lot of repetitive work like keyboard, computer work, painting, those kinds of things, then they start getting numbness in their hands. The first thing to do would be anti-inflammatory medications, over-the-counter Aleve or ibuprofen.
Okay.
Splinting again at night would be helpful. If the symptoms persist, then an injection will usually help for a while, and then ultimately, if they no longer get relief, it takes an operation to fix it.
And that's where you come in. They got to give you a call. What happens during the operation that alleviates carpal tunnel syndrome?
A small incision is made in the hand. There's two ways to do it. One is with a scope, where an incision is made in the wrist. The other is with an open procedure, or what we call a mini open procedure, where an incision is made in the hand. And what we do, this ligament right here that the nerve runs beneath, we open that ligament and take the pressure off the nerve.
Okay.
It's done as a day surgery. It can be done either under local or under general anesthesia. The patient comes in, has it done, goes home. We take their sutures out usually between 10 and 14 days, and we limit the amount that they can lift usually for the first 2 to 3 weeks.
Just to get everything healed up. Is this something, if you're predominantly right-handed or if you're a lefty, is that where it's going to present itself more?
It tends to run in your dominant hand, yes,
Okay.
because obviously that's the thing that you're using most often.
Are there things that people can do if they're starting to experience carpal tunnel that can help prevent maybe having it become so serious?
Especially if a patient does a lot of keyboard work, getting a rest under their wrists so their wrists aren't cocked back so much when they're typing, that's helpful. And again, the splinting at night is usually helpful, and the anti-inflammatory medications.
Okay, start doing those kind of things. If you start to notice that numbness and you do those repetitive type of jobs,
yes,
then you want to pay attention to that. So those are just some of the everyday things. And then, of course, they can always give you a call at Lake Erie Medical Center to get some more information.
Correct.
All right. Thank you so much for coming to tell us about carpal tunnel. It's more common than most of us realize. Thanks a lot, Doctor.